Welcome to our video series titled Preparing Caregivers with Knowledge, Ability, and the Power to Act. This series is sponsored by the Learning Institute for Global Hospice Training, LIGHT, and is available on our YouTube channel, Hospice TV. This is all made possible by a partnership between Hospice Foundation for Outreach and Washington University Division of Palliative Medicine. Hello, I'm Debbie Oliver. I'm a professor at Washington University. Most importantly, I am a former hospice caregiver. I took care of my husband David for almost 4 years. He was diagnosed with cancer and eventually died while on hospice care. I'd like to share some important tips I learned about pain management in hopes they will help you. One of my biggest fears in caring for David was giving him pain medicine, especially when he could not tell me he was hurting. The hospice nurses would tell me to give him medicine in between his scheduled doses. They called it PRN, or breakthrough pain medication. The problem was I was not sure if he was hurting since he could not talk to me. Our nurse had told me to believe him when he said he was in pain, so when he told me he was hurting, I knew what I needed to do. However, sometimes he could not talk to me and I would feel like he might be in pain. The hospice nurse gave me 5 tips. These tips were really helpful in deciding if David was hurting. I want to share them with you. These 5 things helped me know if I should give David that PRN medicine. The first tip was to look at his face. Secondly, listen to his breathing. Next, watch his movements. It was also important to listen to the sounds he was making. Finally, the nurse said I should notice how he responded to my effort to comfort him. Look at his face to determine if he was hurting. If his brow was wrinkled or jaw clutched, it might mean he's in pain. If the corners of his mouth were turned down, or if he have a fearful or alarmed expression, a scowl or a stern look, it could be he is hurting. The nurse explained that when someone is hurting, their body uses a lot of energy to cope with the pain. As a result, that energy usage could be seen in how they were breathing. She advised me to notice if his breathing is noisy or if he is having a hard time breathing. She said to look and see if he looks like he was straining to breathe, if he is gasping for air. All of these were signs he could be in pain. Our nurse Susan next told me to watch how David was moving. She told me to watch and decide if he was squirming, uneasy, fidgety, or restless. Look to see if his fists were clenched, if he was rigid or rubbing or tugging body parts. She specifically said to notice if his legs were drawn up or arms flailing. These were all signs that his movements could indicate pain. Susan also said that David might communicate to me with noises. She said I should listen for moaning or whimpering. Also listen for crying, moaning, or any unpleasant noise can mean he's in pain. Finally, can he be comforted? If my normal reassurance or my touch just would not calm him, then I had to decide if it might be because he was hurting. So, let me summarize. When I wondered if David needed additional pain medicine or if he was hurting and he was unable to talk to me, I observed 5 things. His face, his breathing, movements and sounds all could be indications of pain. Finally, if I could not comfort him in the usual ways, he may be trying to tell me he hurts. When David could talk, I believed whatever he said about his pain. But if he was unable to talk, I had to watch and believe what his body and his actions were telling me. If I thought he was in pain, then I would treat the pain with the PRN dose of medicine. I made a promise to him that I would not let him suffer. I believe no one should die in pain. Above everything else, Susan asked me to always tell her about my observations of his pain. She explained that the hospice team needed to know when he was hurting and how I knew, so they might change his regular dose if needed. These simple tips made me feel more secure and confident in giving that extra dose. Thank you for joining me today. I hope these little tips are helpful. Good luck in your journey.